Migraine symptoms can feel overwhelming and include more than just the usual throbbing pain that goes along with a really bad headache. They can involve nausea, vomiting, and in some cases, extreme sensitivity to sound and light. Some sufferers have even experienced blurred vision or lightheadedness. What's even worse is that those suffering from chronic migraines experience these types of headaches 15 or more times per month. Unfortunately, the pain from each episode can last for hours, even days. Chronic migraines can be debilitating and oftentimes disrupt the individual's quality of life. The trouble with severe migraines is that they usually begin in childhood or young adulthood. Over time, individuals suffering from chronic migraines may be able to predict when they'll get their next migraine because they recognize warning signs from previous attacks. People have reported seeing flashes of light, a tingling sensation, or a feeling of weakness. Some of these symptoms can last a lot longer than the actual migraine and linger on. The good news is, there are different ways to alleviate some of the symptoms of chronic migraines. If you suffer from chronic migraines, it's best to keep a record of any attacks and discuss treatment options with your doctor.
There are a number of different factors that are playing a part when we get migraines. We think of migraines as being caused by primary neuronal dysfunction. We also think of there being alterations in brain chemicals that happen as well. There are many different types of headaches, but migraine symptoms are often pretty unique. Often people feel that they have intense pain or throbbing on one part of their head. They often have other symptoms as well, besides this throbbing pain, things like nausea and vomiting, etc., light sensitivity. Migraine symptoms can last from hours to days, and some people have really debilitating symptoms as well. And some people have additionally what we call a prodrome or aura, meaning they can sense when that migraine is coming on. They see flashes of light, or maybe they get some numbness or tingling. We think of migraines as being caused by primary neuronal dysfunction. We also think of there being alterations in brain chemicals that happen as well. But we know that there are other factors that play a role. We know that genetics may play a role. We know that women tend to get more migraines than men. There are a number of different factors that are playing a part when we get migraines.
Migraine, we'd like to give people medication that actually stops people having migraine. So those processed drugs are exactly what we need across the field. Migraine syndrome has headache as its most obvious manifestation, but some people have manifestations that are not related to headaches. For example, some people have visual impairment, and people might have tingling or numbness or confusion. So those are migraine equivalents, and people have that sometimes without having a headache. It's not easy to convince people that it's migraine when they don't have headaches, but in fact that does happen. I think we understand the evolution of a migraine attack, and we have medications that we can use to try to prevent the spasm in the blood vessels and the dilatation in the blood vessels, but that doesn't get at the reason of why people have that. And there's often a genetic component to that migraine runs in families. There are two different classes of therapies. There are preventors, things that one would take every day to stop a headache from coming on. And then there are rescue medications that one would use when a person actually has a headache. Some of the rescue medication works maybe in 70% of people without making them mentally less agile so that they're able to continue working despite having a headache. And many of the preventive drugs are really quite wonderful. But when a doctor says to you that there are many drugs, it's the same as saying none of them are perfect. There's one that might work for one person but not for other people.
Migraines are chronic. They can occur periodically for many years. Do you have other health problems as well? Well, headaches are a common symptom of many medical conditions. If you're having other symptoms besides your headache, make sure you talk to your doctor. Did the headaches coincide with an illness or an injury? Headaches commonly occur after head injuries with concussions. These post-traumatic headaches can mimic migraines and should be evaluated by your doc. How do you react to your headache? People with migraines often avoid stimulation. They'll retreat into a dark, quiet room. Migraines can also make you sensitive to odors, perfumes, and even touch. Do you limit your activities because of your headaches? Migraines are notoriously disabling and often interfere with work and family commitments. Do your headaches make you sick to your stomach? Nausea is a common symptom of migraines. If you think you're suffering from migraines, or if you've recently started experiencing headaches, it's time to see your doctor.
We know that many people who get migraines really want to go and lie in a dark room with a cold cloth over their forehead. And quite honestly, that might be helpful for you as well. How important is diet in dealing with migraines? So for many people, diet is actually very important when it comes to migraines. Many people have dietary triggers that may actually bring on their migraines. And some common foods that may be trigger for migraines include things like cured or processed meats. For some people, it's aged cheeses or certain drinks or beverages, especially alcoholic beverages, things like wine, etc. But for some others, it's maybe chemicals, things like MSG or other chemicals and additives that are used in foods. And actually, believe it or not, some fruits and vegetables can actually trigger migraines in some people. So really understanding what your triggers are is very important, but it's also important to know that your diet can definitely affect migraines. There are definitely complementary therapies that may be helpful for migraines. I always suggest stress management. Stress reduction can be very, very helpful with migraine prevention and sort of help with that. But also there are other therapies that might be helpful for some people. Things like acupuncture or biofeedback can be very helpful. I also say that for some, meditation is very helpful. Exercise as well. One of the biggest things, again, is to understand what your triggers are, to really understand how you can best treat your migraines.